So we're joined right now in studio by Louisiana Congressman and physician Charles Boustany, and he's here to talk about where Democrats and Republicans are split and where they agree. So let's start off. You met with Steny Hoyer a couple days ago.
Right.
It was kind of a special group, 6 Republicans, 6 Democrats. How did you come together, and where was the friction?
Well, first of all, I had an individual meeting with Steny, and he agreed to set up a meeting with 6 Republicans, 6 Democrats, and we basically focused on where we agree. And we agree on a number of areas in the health insurance reform area. Things where we disagree are raising taxes, obviously, and significantly cutting Medicare for our seniors who are struggling right now, because that's a real problem.
Some of the issues that you agree on, though, that you think will go through?
Well, surprisingly, at least the group in the room felt that we ought to look at expanding health insurance purchases across state lines, and certainly dealing with the problem of pre-existing conditions. Those are things that we have agreement on, and I think, now I don't know if that 6 represents the entire Democratic group.
Well, that's the problem.
What
do you think? I mean, you know, what's your gut telling you on that?
My gut tells me that that's not the case. I think they want, a single-payer system, basically. And what we need to do is continue these discussions, because if we don't, then we really won't know what they're thinking. And so I think it's useful to continue the discussions. But we will draw a line in the sand that H.R. 3200, the House bill, is a non-starter. It raises taxes significantly. It cuts Medicare for our seniors. And
so not enough votes to pass at this point, you're telling me?
I don't think so. No. I don't think so.
One issue that seems to be causing a lot of friction right now, and we were talking about this earlier in the show, is this idea, as Nancy Pelosi says, insurance, drug companies, healthcare industry folks have, quote, much more they can put on the table to bring down the cost. Now, you've got the other side, the health insurers, for instance, getting out here today saying, you are misguided, that's, based on miscommunication, it's just not true. What's your feeling about this?
Well, I think we have to get the facts on the table. And clearly, if you look at the device makers and the pharmaceutical companies, these are very, very capital-intensive industries to create the new drugs, a new stream of drugs and devices that have really improved health care. And I can tell you, as a physician with over 20 years' experience doing cardiovascular surgery, open heart surgery, I've seen the wonderful technology that has made life so much better for so many. Now, at the same time, we need to bring the cost of insurance down, and we need to get health inflation costs down. And neither the House nor Senate bills do that. I know that as a physician, because I've looked at these bills.
What do you make of this whole concept of the windfall profits, specifically with regard to the insurance companies? This sort of understanding that they're going to make a lot of money because they're going to be insuring so many people. The other side says that's going to come down to us. We're going to be paying that.
Well, that's exactly right.
Because they don't make that much money.
Those costs will be passed on to the consumer. And these bills will actually lead to increased cost on health insurance premiums for small businesses and families in particular at a time when people are struggling. It's a wrong approach. And again, what this does, it does not really lower the cost of health care in a sustainable way long term. So it's basically raising taxes and doing some budgetary gimmicks to get by.
Something that has been raising the ire recently, an article in the Wall Street Journal, you can read this, came out, special feature of the Baucus bill that a lot of folks don't seem to know about. Some senators, Democratic senators, have kind of been making little dealies for their states where they get certain, well, I guess, special perks. Chuck Schumer's somebody here who, they'll be, New York will be saving, New Yorkers will be saving more money, whereas people in Kentucky will be paying more money for certain things. What do you think about this whole concept and the fact that I think a lot of Americans don't even know about this?
Well, that's right, and here's the problem. No transparency in the process. These are deals being cut behind the scenes.
Shouldn't these deals not be, how can this even happen?
This is wrong, because what the American people want to see is an open, substantive debate on health care and how do we really solve the problem. And here's the fundamental issue here. What the Senate bill does is it pushes a lot of the cost to the states in increasing the Medicaid program, and the states are already struggling and having severe budgetary problems with their Medicaid programs. And so if the federal government pushes this unfunded mandate on the states, it's going to be a problem. But now you have Senator Reid and you have Senator Schumer creating these little carve-outs on the side, and that's wrong. And what we need to do is get back to the real issue. The real issue is fundamental, good, solid health care reform that brings down the cost for families, for seniors, for small business owners.
Very interesting. Good seeing you. Thanks for coming to New York.
Great to see you. Thank you.
Have a good time here.
Thank you.